Hello guys, so you are welcome to my channel. Today I'll be talking to you guys on sickle cell disease. Sickle cell disease is actually one of the alarming health conditions and is almost all over the world and is really dangerous, destroying lives and families, and it will be good for us to get to know more about it today. So now let's go ahead, let's get to know what sickle cell is. So sickle cell is an inherited disease of the red blood cell. So it's not transmissible, but we inherit it. It's a gene disease of the red blood cells. So the red blood blood cells actually contains hemoglobin. So in our body we have cells. We have the white blood cells and then we have the red blood cells. The red blood cells contains what you call the hemoglobin. So this hemoglobin actually contains what? Oxygen. So for example, if you go to the hospital, we give you oxygen. It is these cells that are going to move the oxygen to various components within your body for your body to function as it's expected to function. So these cells houses the hemoglobin, which is the red blood cells, and is able to travel into the bloodstream to various parts of the body. Now, this is what happens if a person have an unhealthy or an abnormal red blood cells. The cells or the oxygen is not going to travel to various parts of the body, and this is going to cause what we call a stuck, or let's say a block within the blood vessels, and it results in pain. So most of the time you say that sickle cell patient complains about body pains a lot because the oxygen is not able to reach certain parts of their body, and that is very crucial. So now the normal red blood cell had a biconcave. For example, if you take the normal CD we used to use, the normal CD cassette that we use, how it looks like, that is how the red blood cells look like within our vessels, and then is able to travel. Now for sickle cell patient, this very shape is halved, more like a moon size, and is not able to flow freely within the blood vessels, and this causes a lot of health conditions. They might have chest syndromes. They might also have shortage of hemoglobin. Almost every week these people will be going to the hospital for transfusion, for a whole lot of therapy, because they are having this particular disorder. Now let's get to know the types. So there are various types of sickle cell disease. So we have the hemoglobin S, we have the hemoglobin AS. That means the hemoglobin AS seems to be a mild infection, and sometimes these people, we call them the sickle cell traits. So one is that the person inherited a normal hemoglobin from one mother or from one parent, and then inherited an abnormal hemoglobin from the other patient, which is the abnormal is the hemoglobin S and the normal is the hemoglobin A. So when these two come together, the patient will become AS. So that means we say the person is a sickle cell trait, or has a sickle cell. Yes, it's a sickle cell trait. Let me put it that way. So now let's get to know the sickle cell disease patient. For example, someone might have two abnormal hemoglobin. That is the hemoglobin S from a mother, for example, and then another hemoglobin X from a father, and then SS. And then research has shown that these people usually don't live longer, but is cost effective. When I say cost effective, it is not always true. People are SS and they are able to clock like 40 because they have the money to go for the therapies, the medication and everything that they want. But people who don't have the money, to the resources to engage themselves in this therapy, within 28 years of age they might die off, and it's very, very fatal. Is very, very fatal. So now let's get to know into the labs. We go through a lot of process to diagnose or to confirm that no, this patient we are dealing with is a sickle cell patient. Now the first is that a doctor might request a full blood count or a CBC. It will be very good if you run CBC test almost every month or almost every 2 weeks, just to get to know your hemoglobin level. For example, if you go to the lab and then you run an FBC and you check your hemoglobin level, let's say today you run the lab and it's like 10, the following 2 weeks you go and it's like 9, the other week you go and it's like 7, that means you get to know that no, there is something wrong within your system. Your hemoglobin, which is the protein and then the oxygen carrying component within your blood vessel, keeps on reducing. That means there is something not really right. So once a doctor got to detect that no, your hemoglobin is reducing faster at a faster rate or is in a gradual process, the doctor will then be suspecting that possibly you might have a sickle cell disease, and then possibly recommend other tests like the iron studies to get to know the iron component within your blood system, how they are functioning. Are they a lot or are they reduced? So it's very good to visit the lab, get into the lab, get this test done. Once a doctor is not convinced enough, then he or she goes to the HB electrophoresis. Let's get to know your genotype. Or even before the HB electrophoresis, we do the sodium metabisulfate test, which is the Sickle test. Most of you know the Sickle test. We get to know if you are positive or if you are negative. Once you are positive, that is not all. Don't say I'm a sickle cell patient, or you might not know if you are a TREX or let's say you are an SS patient. So you do the HB electrophoresis. If you are positive, we get to know that possibly the positive is as a result of AS or SS patient, and then you get to know that you are sickle cell patient. So that is that. And if you are negative, that doesn't mean you are free. The test is such that once you are AC, we are not able to detect from the sodium metabisulfate test. But if it's good for you, if you want to know your genotype, once you run the Sickle test, go ahead and do the HB electrophoresis. Now let's get to know the preventive measure. If you are a sickle cell patient, that is what you are supposed to do. Because your oxygen content is reduced within your system, you are not supposed to low oxygen. When I say low oxygen, that means you are supposed to always be in an environment that has a lot of fresh air coming in. Oxygen should be constantly flowing within your system so that you may not fall short of oxygen. Once you fall short of oxygen, there will be stress on the cells and then the complications will set in. And the complication can be yellowish eyes, it can be falling sick, infection here and there. Now you are supposed to stay hydrated, drink a lot of water. You are not supposed to also engage yourself in extreme exercise when it comes to high altitude, climbing mountains up and down. If you are supposed to do that, you are supposed to do that with caution. So with caution, don't go to the extreme, or else your cells might trigger, and then most of the times it will clog your cells, and then there is nothing you can do about it. The complication stage will just set in. Now there is a good news. What is the good news? If you are if you are sickle cell positive, FDA on the 18th of December has happened to come out with a diagnosis. Earlier on, there was a diagnosis or there were treatments, but those treatments were not 90% accurate. When I say 90% accurate, there are possible complications that after going through those procedures, it might not keep you longer for years or possibly for certain days, because it has to do with a bone marrow transplant, where we do stem cell transplant. We take a bone marrow transplant and then exchange it with someone who has a normal hemoglobin cell into yours which is abnormal, and then you are able to sustain life for some time. But there were complications. Now there is a good news. On the 8th of December, we were able to develop the CRISPR that has to do with gene editing therapy. Now we are able to edit the abnormal gene, which is the abnormal hemoglobin X. We edit it, we harvest your stem cell, and then we edit it and then replace with a healthy hemoglobin, which is the hemoglobin A, and then we infuse it back into your stem cell, and then you are able to go sustain life for some time, or sustain life, because this has proven to be accurately, and then people that have received the therapy are cleared of any sickle cell symptoms or abnormalities or complication, and is safe. Just that it has not gotten yet here in Africa, and is going to be cost effective. Hopefully it comes here and then we are all safe.